My name's Jason McKinney. I'm a nursing student at the University of Charleston. I'd like to do an educational video about COVID-19, also known as the coronavirus. In this video, I'm going to be answering the questions of what is COVID-19, what are the signs and symptoms of COVID-19, how is COVID-19 transmitted, what are the steps to protect yourself as a healthcare worker, including the PPE, and what are the steps if you are directly exposed to COVID-19. Now, all the information I've gathered is from the CDC website, so please go there, research this for yourself, try to find out all the information you can. First, what is COVID-19? In COVID-19, the CO stands for corona, the VI for virus, and the D for disease. Formerly, this disease was referred to as 2019 novel coronavirus, or 2019 nCoV. Now, a novel coronavirus is a new coronavirus that has not been previously identified. The virus causing coronavirus disease 2019 or COVID-19 is not the same as the coronaviruses that commonly circulate among humans and cause mild illness like a common cold. Now, the signs and symptoms for COVID-19. These symptoms may appear 2 to 14 days after exposure based on the incubation period, and that's a fever, cough, and shortness of breath. If you develop emergency warning signs for COVID-19, get medical attention immediately. The emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. Now, how is COVID-19 transmitted? The virus is thought to be spread mainly from person to person, between people who are in close contact with one another within about 6 feet or closer. Through respiratory droplets produced when an infected person coughs or sneezes. It's also believed that it can be picked up from objects that you would touch that have been contaminated by an infected person. Now, what are the steps to protect yourself as a healthcare worker? As with everyone, the most important is frequent and proper hand hygiene, hand washing. Also, when you're giving care to patients, use your PPE, gloves, gowns, an N95 mask, and again, most importantly, wash your hands. What are the steps if you're directly exposed to COVID-19? First off, stay home. Most people with COVID-19 have mild illness and are able to recover at home without medical care. Do not leave your home except to get medical care. Do not visit public areas. You don't want to risk infecting somebody else. Stay in touch with your doctor. Call before you get medical care. Be sure to get care if you have trouble breathing or have any other emergency warning signs, or if you think it's an emergency. Avoid public transportation. Avoid using public transportation like ride sharing, taxis, if you live in larger cities, subways or railways. Stay away from others as much as possible. You can stay away from others. You should stay in a specific sick room if possible and away from other people in your home. Use a separate bathroom if available. Try to limit contact with anyone to try to prevent spreading this disease farther than it already has. Now, if you'd have any questions about proper hand washing, there are videos on the CDC website to show you how to properly wash your hands. They need to be washed with soap and water for at least 20 seconds. Also, it gives you a list of the symptoms, the signs, the things to watch for. And most importantly, just try to remember that this is a contagious disease, so we need to try to take what steps that we can to help prevent its further exposure to people. Thank you very much.